Welcome back to the program. To take us further, the Permanent Secretary, Lagos State Ministry of Health, Dr. Olusegun Ogboye, is joining us to speak about mental health. Thank you for coming on the program today.
Thank you.
Good afternoon to you. Now, can you educate us about, and as sparingly as possible, on what exactly leads to mental health disorder or decline?
I think in the simplest terms is the pressures of life that basically push you. And what happens in some cases is you have social safety nets, your family, your support system that keep you hooked. And then also the fact that there's so much stigma around mental health. So when you first start feeling signs that things are not quite right, because it's atypical in this kind of area to seek help from a psychiatrist or a psychologist, you bottle it up in, and then it builds and builds and builds, and then it leads to more serious forms of mental health disorders.
Speaking of which, we know that there are different types of mental health disorder, but depression seems to be the most notorious. Why is that?
Again, it's also because it starts, nobody does anything about it, and then it gets worse and gets worse and gets worse. And it's a whole spectrum, the whole mental health spectrum. And it starts from simple things, from full mental health to the worst types of mental illness, the psychotic disorders. And usually if it's caught early, then it doesn't go down the spectrum. But we don't get to catch it early because of issues around stigma, like I said. And the fact nobody even really wants to admit that they have an issue that requires that kind of help.
We'll talk about that stigma in a little bit. But for now, the Lagos State government has released some data, and it shows that the impact of COVID-19 is also felt very negatively as far as mental health is concerned.
Yes, we did notice that there were issues around issues like even domestic violence, sexual violence, and just basic disorders around mental health. Because people are cooped up for such long periods, people are unable to work, unable to earn any money. So I think the pressures around that worsened the general day-to-day pressures that tip people over the edge. So I think, yes, it did tip a lot of people over the edge. And we also recognize the need for that. Even in the response team that were working on COVID, we had a psycho team that was dealing with their psychological issues, trying to calm them down and bring them back to normal.
Now, drug abuse seems to be a very salient or obvious contributory factor to mental health decline, especially amongst the youth. What can be done to help people who are taking drugs to feel better?
I think the first thing is prevention. Let's let people know the risks that are inherent in taking drugs. Let's try and control the availability of the drugs as well. And then let's give them access to care, access to someone to talk to when that urge starts. So that's part of why we now have the lifeline, the Lagos Mind Lifeline that's open. So the people who are at the early stages of it, or whatever stage of it, you can talk to someone who can help get you access to help and also talk you out of it when you are, maybe contemplating doing it, if you're still at the stage where you can be talked out of it.
We heard the Lagos State Commission of Health speaking about why it's so important. He's very concerned about it. Now we can come to brass tacks. What is the Lagos State government doing in this regard?
We're doing a lot about mental health issues generally. Drug use disorders are just one portion of it. Alcohol use disorders are there as well. There's mental health even in pregnancy and postpartum depression. And so what we're doing is we're reaching out even to children in school now. There's the school mental health program that we're trying to sensitize them about the risks that they run, even at this young, impressionable age before they get into drug use at all. And then we're expanding our services in our health facilities and also trying to expand the human resources available for dealing with people with mental health problems as well as drug use disorders. And then we're also trying to ensure that there's access, again, like I said, to a 24-hour line that people can reach out at that low point when they're trying to make the decision whether to or not to.
I was going to come to that. Is that line still available right now?
It's still available, yes.
Okay, so we can go where to access it?
It's 090-9000-6463, which is 090-9000-MIND.
Okay. How can you differentiate between eccentricity and people who are giving signs of mental health decline?
The thing is,
And those who are trying to cover it up?
it's not really our job to make that distinction. Anybody that seems to be showing signs, whether it's because of eccentricity or it's actually a mental health disorder, let the experts do it. The experts in counseling, the expert psychologists, the expert psychiatrists, let them make that distinction. So let's channel everybody that is showing signs of maybe moving away from on the spectrum, away from the full mental health side of the spectrum. Let's try and channel them to see an expert who can then make the distinction.
A final word from you in the sentence. What will you say, or more than a sentence, what will you say to Lagosians on what the Lagos State government is doing concerning mental health for the people?
Okay, I'll say first, we set up a mental health policy. We have a mental health law. We're probably the only state that has done that. We have this mental health conference that the last one was in 2013, so it hasn't been as often as we planned it, but there's another one coming up on Tuesday, the 18th, that brings together experts in mental health, people whose job is in some way influences issues around mental health, the law officers, people working with children and all that, so that we can bring it to the front burner. We can talk about issues around funding for mental health, issues around reviewing our strategies and seeing, are we doing the right things? What's the right way? What is going on? And then recognizing, even the Lagos State government, for our own employees, we have what we call a Laswell Center now, where if you recognize any small derailment in someone who was a stellar member of your staff before, you can quickly have a word with them and then get them to see. Very discreet. It's not a hospital. It's set up really nice like your studio, and then you can get access to help. There's help for pregnant women or postpartum people postpartum. There's help for drug users. There's help for alcohol users. Well. So there's help for everyone that's available.
We certainly wish you the best as you continue to do this. The Permanent Secretary, Lagos State Ministry of Health, Dr. Olusegun Ogboye, thank you for coming on News Across Nigeria.
Thank you very much. Yes.